What happens when the normal mechanism of erection is compromised due to penile arterial insufficiency? This question leads us to the topic of arteriogenic erectile impotence, a condition far more prevalent than previously assumed. Arteriogenic erectile impotence is characterized by an inability to react to relevant sexual stimulation. This is due to a change in pelvic and penile hemodynamics that inhibits the increase in pressure in the cavernous bodies, thus preventing vaginal intromission without special precautions. Moreover, the inability to maintain this pressure ordinarily until ejaculation also characterizes this condition. But what's the underlying cause? Arteriogenic erectile impotence is triggered by insufficient arterial blood supply to the cavernous bodies. Irrespective of the type of arterial disease or abnormality causing the insufficiency. Before diving deeper, it's important to understand the normal mechanism of erection, though it's not fully understood. The accumulation of blood under pressure in the cavernous body results from the dilation of the arteries to the cavernous spaces and the closure of the drainage from the cavernous body. This drainage blockade is active and located just inside the tunica albuginea, at the origin of the emissary veins. The process is likely associated with the smooth muscles of the cavernous body, which become relaxed at the start of an erection. Furthermore, passive outflow restriction probably supports the active closure when the cavernous body is distended. The autonomic nerves regulating the erection originate from the 10L2 and S2S4 and pass the pelvic plexus. The target organ neurotransmitters involved are probably vasoactive intestinal polypeptide and catecholamines. Now, how does one identify penile arterial insufficiency? It can be demonstrated by penile blood pressure measurement, either as a simple measurement or more effectively, as pelvic steel test and hyperemic stress test. Ultrasonic Doppler pulse curve analysis is another method of demonstrating penile arterial insufficiency. Visualization of the arterial disease causing penile arterial insufficiency requires bilateral selective internal iliac arteriography. To recap, arteriogenic erectile impotence is a condition characterized by the inability to react to sexual stimulation and maintain erection due to insufficient arterial blood supply to the cavernous bodies. The underlying mechanism involves the dilation of the arteries to the cavernous spaces and closure of the drainage from the cavernous body. Diagnosis involves penile blood pressure measurement, pelvic steel test, hyperemic stress test, and ultrasonic Doppler pulse curve analysis. Understanding the pathophysiology and clinical features of arteriogenic erectile impotence is crucial for medical professionals, researchers, and patients alike. Knowledge is power, and in this case, it can lead to better diagnostic methods, innovative treatments, and ultimately, improved patient outcomes.